Dr. Zhang, thank you very much for being with us. Having a good time here in the hospital and in Barcelona?
Yes, thanks. It's a very hot season, hot people. Yeah, I love Barcelona. Yeah, I love Spain. Yeah.
Let's get into the matter. We're talking about Alzheimer's disease.
Yeah.
This surgical approach to Alzheimer's disease is absolutely a revolution. It's very new.
Yeah.
From my point of view, it's not curable from what we know, and there wasn't a surgical approach until now. Tell us a bit more about this, because it's really, really new.
Yeah, it's a brand new surgical approach in microsurgery. I'm a microsurgeon. Maybe 3 years ago, so we are doing a lot of lymphedema in the extremity. But recently, so the Alzheimer's disease, we used the microsurgical approach to treat this kind of disease, just like come to appear in the clinical surgical operation. So one of my friends in Hangzhou City, Dr. Xie, he performed this like 4 years ago. It's an occasion, just he do some neck surgery. Then he just hook on there's some lymphatic vessel, some leaking. Then just hook on the lymphatic vessel to the vein. So this patient has the Alzheimer's disease. So then after the surgery, he found the patient. So Alzheimer's, the symptom is improved, is go back. So far, in the dementia patients, so there's no way to stop. Also, there's in dementia patient, you cannot stop or also the prevent. It's always going worse and worse and worse and worse. That's the way you cannot go back. Then suddenly this kind of surgery is very hot. That he reported this is very hot in China. So far in China, the last year, is more than 300 hospitals already performed this kind of surgery. Also for us, we after the long time waiting for our hospital, the ethic community approved. So we start our clinical trial is last May. So far we are almost finished, like more than 50 cases.
How many cases?
50.
Okay, 50
cases. So 30 in my group, 30 to 40% is a big improvement before and after. The rest, 30 to 70% improved. Everything improved, but just a little. Just a little. So far, but so I cannot tell. So there are some what's happened inside in the brain. So I cannot tell so far. So we are still need to do more research and to study what's happening in the but we already find some results. Some A beta protein and the top protein. This kind of protein is damaged to the brain. So it's decreased after surgery. But this is the result. So what's happened? So why to cause this protein is going down to just like improve the cognition, improve the movement, improve the symptom. So this is our next step. So this surgical approach is not too complicated. If you are very good microsurgeon, like Jomi, like whatever, all around the world, if you are good microsurgeon, so you can perform this. But the only way, our next step is we just try to find, so which is better AD patients is indicate for this kind of surgical approaches. Because we will do the multi-center studies.
Okay. So what's the surgery based on? What's the hypothesis then?
Yeah.
What are you actually doing when you're doing the surgery?
Yeah, this is very good questions. There's some 10 years ago. There's some paper published in Nature. This is a very high level in academic in the journals. So the paper is shown in the rats, the mouse. They show there's some every day. So the brain used like 20% of the energies. So produce a lot of waste in the brain. So the waste should, like the extremity, like the trunk, you need drainage from the brain to the whole circulation in the body. So this waste include the tau protein, A beta protein, this kind of protein. So this is the waste proteins. So if the proteins is deposits, it cannot drainage outside, so they will damage the neural cell.
Okay.
So they will cause the Alzheimer's disease, cause the dementia, cause whatever, this kind of syndrome. So this paper is reveal the proteins can drainage to the meningeal lymphatic vessel. You can see the meningeal lymphatic vessel, then go to the neck. They can go outside. Also this paper, so also in the brain exists the lymphatic system, like the extremity. In the body we have two circulation systems. One is the vessel, the blood vessel circulates. The another system is lymphatic system. So normally the waste proteins is drainage, the circulation is along the lymphatic system. So if this system is damaged, so they will cause the protein is deposits, just gradually, they will cause. So the Alzheimer dementia patients the symptom is gradually become worse and worse and worse. It's like this. So we call this system, like the extremity, we call the gut lymphatic system. It's not lymphatic system, it's real lymphatic system. Like we have the lymph node in the extremity, also in the neck. But in the brain, we don't have this kind of structure. But this system perform the same function, like a lymphatic system. So we call the gut lymphatic system. So that means the exchange. The gut lymphatic system exchange the CSF, the cerebrospinal fluids, to the interstitial fluids. So in the surface of the brain, they exchange. So the proteins can change to the gut lymphatic, through the gut lymphatic system to the meningeal lymphatic vessels. Then meningeal lymphatic go outside, the drainage outside to the neck, because the neck is the junction between the head and the body. So now we find if you also there's another paper is published is if you improve the gut lymphatic system, or if you improve the meningeal lymphatic vessels, they will release, or you improve the cognitions, really symptom of the. So now the system, the whole system is a gut lymphatic system is do the exchange of the waste products. So the waste products through the gut lymphatic system go to the meningeal lymphatic vessel. So the meningeal vessel outside of the brain go to the neck through the thoracic duct to the whole body circulation.
Okay, and I get rid of the toxins of the accumulation.
Yeah.
You were saying before it's not very complicated if you're a good microsurgeon, which is not the case in everyone is not a good microsurgeon. What are the risks involved in this procedure?
So far, our group there's no complications. So the surgery is very, very simple. So normally for each patient, each site, just less 2 hours. So we are normally within 3 or 4 hours, we can finish this surgery. So that the next day of the surgery, so the patient can walk, can talk, can eat. So it's very, very safe surgery. Also for for some weak patients, like more than 8 years old, so we just do one side. It works. Yeah.
Does it work in every kind of patient with Alzheimer's? Or you have to choose the exact, the perfect patient for this procedure?
So far, I cannot tell you. Yeah. So only in my group, so we select all the the mild and the moderate and the severe dementia patients. So they all works, but only 30. I say only 30 to 40% big improvements. So even there's no medicine can go back. So it's a very big, surprise for us, for surgeons, So we can use this to treat, to pull the patient back from on the way to the end,
Yeah. You were saying before that they're doing it in 300 hospitals in China and also other places in the world. They're starting now. Is it like that? Are they doing it in other places, in other countries?
Yeah, the last year a lot of visits from US, from Europe, also from Asia. so far in Asia is very popular. So because this surgery is beginning from China. So in Hong Kong there's 2 hospitals. I think they already approved. They already did 1 or 2 cases already. Like a Korea, my friend JP also did like 3 or 4. Also, Chinese Taipei also they also did 1 cases. Also Singapore, also there are 3 hospitals visit to me. I think 2 hospitals already approved. They already started. Also Japan, yeah.
I was thinking it's absolutely a revolution, isn't it, in Alzheimer's treatment? Because I was saying before, there isn't any treatment for Alzheimer's. Once you have it, it's going to stay with you forever. This is going to change if it actually works like you want it to work, and you have enough people to get your results and to understand the results. It's actually going to change totally the treatment of Alzheimer's, isn't it?
Yeah, so you change the patients just a part of, because they change their life, change their family life, So the cost, so the patients just, for the dementia patients, just they cannot recognize, they don't have the behavior is abnormal, also they can do the life, the life daily, activities. So the family, so that the relative, they are very, suffered. Also the social abundance, is very high. So even the relative, the family see just a little, also some improvement, they are very happy. So I cannot say after surgery the patient to go back to normal. So I can't say so, but I can promise there are some improvements. But so far, so we're still studying. So which kind of patients, also for these patients, so which symptom they can improve. So before the surgery, I can, so these patients, I can maybe in behavior, maybe some motion improves, I cannot take. We still need some more research inside the brain. Yeah.
So it's actually still a work in progress, but the work is really promising.
Yes.
Absolutely amazing. Doctor, thank you very much. It was very interesting. I hope everything goes well, and other studies make Alzheimer's treatment a bit better for people who have the problem.
Yeah, so Alzheimer's disease, in China, so recently there are some, in the literature, we already have like 10 million people suffer from the Alzheimer's disease. Also until 2050, the middle of this century, in China, it's like 40,000, the 80. I think the world is the same, because the world is getting older.
Yeah.
Because until 2050, in China, it's like maybe half people above 60 years older. So China also the world become, because we have long live, so AD patients, so that become more very important and very important disease for us. Also, we are very exciting for me as a microsurgeon, so we can do some contribution to treat this disease.
Yeah, absolutely.
Yeah.
Dr. Zhang, thank you very much.
Thank you very much.
Thanks.
Yeah.